All right, on this episode of You Should See a Physio, we're going to get into
the knees.
The knees, right there.
That was good.
That was
Usually two.
Two knees per person. All right, let's go over first a couple of important things. First, why do we have knees? Ryan, why do we have knees?
So knees function as this middle point for the muscles between the hip and the knee to allow us to efficiently walk. So it's almost as a pivot point for essentially that giant quad muscle that you have to allow it to pivot over that with the tendons so that we can be more efficient when walking. If we didn't have it, we'd probably be stiff and bow-legged and walk probably more so like a penguin or something along those lines.
That'd be awkward.
It allows us to be efficient in pretty much all we do with our legs.
The knee is actually made up of two joints, actually more than two joints, but for the sake of what we're talking about, as most people think of the knee, it's made up of two joints. The actual knee joint, which is the big femur bone, and the shin bone called the tibia, but it's also made up of a joint called the patellofemoral joint, which is your kneecap that sits inside of there. And the kneecap is very important, and it also makes a lot of weird noises that people freak out about. So what's the point of the kneecap, and should people get concerned about the noises?
Again, the kneecap there for kind of that pivot point, so that tendon can attach from the big quadricep muscle that Gene just talked about to the lower tibia bone, essentially. And all the cracks and the noises and everything you hear that you're like, oh, I woke up and kind of heard that, is mainly just essentially either what we call crepitus, which is kind of whole tissue that we're kind of just running across, or it's along lines of gas bubbles, right? So if you hear a loud crack, or like when you crack your knuckle, that is just a gas bubble within the joint that essentially is being expounded throughout the joint. And that's what that audible noise is that we're hearing.
The undersurface of your kneecap is actually pretty smooth, but it can get a little jagged and rough as you get older or through various activities, and it's really dependent person to person. So you can hear the rubbing and grinding and all that kind of stuff. That doesn't mean anything is broken, doesn't mean anything serious is going on. It doesn't really mean that you'll have pain, or even if you do have pain, it doesn't mean it's because of the noises. They're just there most times. But the kneecap is very important to disperse forces, like Ryan said. So if we have Callie here, who is a stud soccer player, every time she kicks or moves her knee, if that force dispersion isn't there because of that kneecap, that means it would really put a lot of stress on the knee joint itself, but also on the muscles. So that the kneecap is very, very important and plays an important role within the whole knee system. And you should really think of it as a system. So why should you see a physiotherapist for knee pain? Great question. Let's get into it.
Well, for number one, we're going to be able to get, we'll call kind of the source of the issue. So a lot of time the knee gets a bad rap in that we always feel pain there throughout multiple activities that we do. But a lot of times it can really be the source of the issue coming from the hip in terms of potentially weakness or moving slightly differently in that joint, or perhaps maybe it's a range of motion or mobility issue at the ankle. So seeing a physio can allow us to essentially take a look at you from a larger perspective and see, why is your knee having pain? Because usually the knee isn't the issue at all. It's somewhere either farther up your leg or farther down your leg. And from there we can determine what's the best plan of action to get you feeling better.
The other big piece is the structures within the knee, so like your meniscus and your ligaments. We know through research that if you have a meniscus there, usually the first option people think of is surgery. But what we know now is that having surgery isn't necessarily your best bet. Usually having rehab and retraining your body to move again, because your body can sustain and adapt to various changes, even with structural damage like a torn meniscus. If you go through rehab and you reinstate movements that you've been avoiding, your body is incredibly adept at getting you back to function and decreasing pain over time.
So if you see a physio, what are we going to do? We're going to first determine what the source of the issue is for you, even if the pain is coming from your knee. Two, we can discuss plans and options of how we can conservatively get you back to doing the activities you want to do. And three, we can determine if that approach doesn't work, do we need to refer you out to somebody who can take a closer look at your knee from that type of perspective. So any way you cut it, we're able to help you from the beginning and get you back to the kind of care you want, and that's what we're here for.